First of all, thank you for allowing me to do this presentation. And we study if urinary ATP concentrations are related to the detrusor pressure during voiding. And by Ferguson's study, ATP is released by the urothelium through a mechanical stress like pressure, stress, and hyposmotic stimulation. So during normal bladder filling, ATP is released by urothelium as the bladder distends. And both stress and pressure induce ATP release from urothelium. So we hypothesize that bladder pressure during voiding influences urinary ATP concentrations. So we study all my patients under investigation by Lutz to perform urodynamic studies, and after apply exclusion criteria, 15 male patients were included. In our study, we didn't find any correlation between age and urinary ATP concentrations. As you can see here, urinary ATP is correlated with pediatric Qmax, so voiding dynamics affects urinary ATP concentrations. So higher detrusor pressure during voiding may cause a higher ATP release from urothelium, resulting in a higher ATP concentrations. And this effect is independent of the voiding volume and therefore of the stress-induced ATP release. So as you can see here, urinary ATP correlated also with bladder outlet obstruction index and bladder outlet contractility index. So in male patients, the detrusor pressure more than bladder distension impacts on urinary ATP concentrations. There are no significant on this population. There are no significant difference in between urinary ATP between patients with and without overactivity. However, those who have phasic overactivity tend to have higher ATP concentrations, as you can see here on the second box plot. In this population, patients with detrusor overactivity didn't have higher pediatric Qmax or higher bladder outlet obstruction index. So, bladder pressure during voiding induced ATP release and urinary ATP concentrations are directly correlated with pediatric Qmax. Urinary ATP may be a surrogate marker of detrusor pressure during voiding. So, as a concluding message, we believe that urinary nucleotides may have a role in the diagnostic workup of LUTS in the future. So, thank you for your attention.
Your final conclusion is about diagnostic value.
Yes.
There is a big difference between something being correlated, which may give interesting insight to pathophysiology, and something being of diagnostic value for which you need things like a positive predictive value, a negative predictive value. So I have two questions. Question number one is, before you set out to do the study, did you have the specified hypothesis, I'm looking at the relationship with detrusor pressure? Or did you just say, I'm looking at a range of parameters and see which works best? That's first question, they're related. And the second then is, have you done such calculations for positive and negative predictive value?
Okay, I answered to the second question now. We didn't this investigation yet. For the first question, we look in this group of patients with BPH specifically for the pressure for the voiding phase.
Okay.
We look specifically because we already have another studies for distension, overactivity, bladder in women. So, yes.
Okay. I think that's very important, whether in general, whether there was a hypothesis to begin with, or whether you are just showing us the parameter that correlated best, which has a higher percentage of false positives intrinsically. Good. Thank you for clarifying that. What holds you back from doing a positive predictive value calculation?
First of all, we need to have a bigger sample to do that and see if the results follow this previous study, and after that we can study the predictive value and everything.
Okay.
Hi, Tony Kanai from University of Pittsburgh. So you said you were looking at pressure and ATP as a function of pressure. Was it in BPH, you said? Did I misinterpret? Did you say in benign prostatic hyperplasia?
This group of patients specifically have
okay.
BPH.
Well, what I'm saying is BPH is a histological evaluation, so there's not necessarily a correlation.
Yeah, but on obstructed patients urodynamically.
Okay, so you are suggesting then this would be a good predictability for BPO?
Maybe.
Okay. Thank you.
Okay, thank you so much.
Okay.
And I don't see any other questions, so thank you and